I'm here doing the weekly huddle again. This time we're by the huddle board, so we'll kind of go through topics on the board. First of all, I wanted to start with our people pillar. I want to welcome Hannah and Ashley, they're two contract nurses starting in L&D this week, as well as Sarah Pica, who's our new antepartum postpartum manager. So when you guys see these people, make sure you welcome them and say hello. For quality, we're looking at some QBL data, and Danielle put some nice graphs over here so that you guys can kind of understand them. It pretty much talks about how many hemorrhages we had. Of our hemorrhages, how many were low risk, how many were high risk in your risk assessment, and then looking at QBL documentation compliance. So what we're trying to do by posting this is just to show you that we're focusing on it. Where we're seeing lack of documentation is really in the recovery phase. So you really need to be doing that. This month we're just looking at overall numbers, but next month we're going to be looking at individual nurses, and we'll be coming to talk to you if you haven't been doing your recovery QBL. Let me see, for recognition, there's a couple of things. Congratulations to Stephanie, Indy, and Brianna for being promoted to RN2, that's awesome. And anybody else who needs to be in RN2, if you've been here 18 to 24 months, you need to give me a packet and we'll get you promoted and get you more money, so that's awesome. Then I also printed out a list of all of the recognitions for this past couple of weeks. There's some great things in there about L&D nurses and what a great job you do, so that's awesome. Come and look at that. I really wanted to manage up Jessica Adelet for volunteering to do the eye care refresh project. All units have to do a shadow box and fill it out. The theme this year is innovation. So if anybody has any interest in helping, go see Jessica and volunteer your services to her. Let me see what else. So growth. We're starting our L&D refresh. So we've got 3 rooms shut down for the next 90 days. So it's 36, 37, and 38, and they're also going to do that nutrition alcove room as well. The reason why we're doing 3 instead of 2 is because we had an odd number of rooms left, and we decided to take the hit in the winter when our volumes are a little bit lower than in the summer when we're just booming out babies left and right. Speaking of volumes, yesterday our delivery total was 11. That brings us to 213 for the month and for the year. And so that puts us right on track for having about 330 for the month of January. So that's pretty good. You guys know about the Texas A&M students that are here, and it's William who is with us in labor and delivery. So if you see him, please make him feel welcome and give him a good learning experience. I also wanted to reiterate it again that the physicians really want no videotaping of C-sections or vaginal deliveries without their consent. So if you see that happening, just try and interact with your patients and their families and explain the reasons why. I did put up our new updated patient satisfaction scores, so you guys can come and look at that. This bottom one breaks out our department versus other departments, and we're doing really well at an 82.1 for the year to date, and I think that was the end of last year. And then I know this is super small, but feel free to pull it down and take a peek at it. For our issue board, Danielle and I are really trying hard to work on this. It's hard because there's a lot of moving parts and we have to wait for follow-up on a lot of people. So I promise we're not purposely dragging our feet. Sometimes things just take a little bit. So some big things that are done. There's a lot from the antepartum unit that Claudia helped us finish, so those are all completed. Also the broken bed in the PACU, that's been fixed as well. I followed up with security again this week. They're in the process of getting a new manager as their manager left, so there's a little bit of delay because of that. We've put in work orders to get the OR clocks done probably 3 times now, so we're going to follow up and make sure that somebody can get to do that. But please know we are on top of it and we're working on it. It's just not completed. And we're also working on epidural keys, and so that, again, we've talked a couple times about getting that. So we're researching Dr. Baker's chair and getting a quote on that. And I'm sending another email to IT again. They need to build out some nursery beds for the antepartum unit, so that requires another follow-up. And then Cindy is working on getting quotes for the sponge count holder in the OR. I guess the IV poles that they are on, I don't know, are falling apart. I don't know. We're trying to get 3 new ones, but it's hard to try and find the original vendor and get those. And the Novies, we're working on getting pigtails for those too, but GE doesn't sell those, so we have to find out who does, and it's a bit of a digging process. Education. Robin and Kristen really wanted to give me to give you guys some information. So first of all, they need volunteers to attend the Ebola training. This should be OBED nurses and charge nurses, If this date doesn't work for you, the man who's putting it all together has said that there's other opportunities available across the system at the ECCs and the ERs, because they all have to go through the training as well. So you can see me or Kristen, and we can reach out to Sterling if this date doesn't work for you. But we definitely need to see a good group of people turn out for this training. The next thing is orientation checklists. I know Kristen's been working really diligently to make sure that we get all of our orientation checklists turned in. So I want everybody to check their lockers and make sure that you don't have paperwork shoved somewhere in a corner underneath everything else that you have. But get it and get it turned into Kristen so she can mark you off. Not only do we need the paperwork to show that you're competent to do what you're doing, but it's a component of designation. And if they come and if your chart is the one that they asked to pull and we don't have any of your orientation checklists, that will be a huge ding for us. So we really need to get our paperwork straightened out, and Kristen is working hard to do it, but she can't do it alone. You have to help her out. So make sure you turn in your papers. And likewise, if it's a slow day, and I know recently, rather than putting some people on call, they had some people orient, it's really important that you get your documentation done and turned into Kristen so that we can keep track of who is oriented to where, and we know kind of where everybody can float. Let me see. Also, Muse is going live soon, so I got a list recently of a bunch of people that hadn't done their Muse LMS. So I need you to go into SuccessFactors and go to the Learning tab and do your Muse LMS. It's a really short thing, but it's important, and you're going to need to know how to respond when you get this alert. It's mandatory that you have to call the physician, and there's a certain amount of time. We're getting little laminated cheat sheets that we're going to put in the wallaroos and in the rooms so that you guys will know when you need to call and the process that you need to take, but you need to do the LMS. The other thing is Gnosis. So there was a huge amount of people that didn't complete their Gnosis last year, so we're asking everybody to do that. I know that there was also some problems with reporting. So if you got the email that you need to do your Gnosis, but you've already done it and you have the certificate, please give it to myself or Kristen or Robin so that we can check you off that you've done it. That again is a component of maternal designation, and so we really need to get all that documentation done. For that, and that was for last year for doing all 5 of the modules. If you've done those, then right now you need to be doing promoting vaginal birth and shoulder dystocia. So the deadline for that,
2/14.
There you go. Thank you, Danielle. Yeah, totally forgot about that. But 2/14, and it's really a hard stop deadline. And I don't want you guys to think that I'm kind of being mean, but I really need to hold people accountable. And as our accountability is one of our core eye care values, we really need to make sure that this gets done. And we don't have the time or the ability to chase people down to get these things done. I really feel like you guys are all professionals and you're responsible for your own education and growth. And so if there's a mandatory requirement, it's an expectation that you get it done without us chasing you down. So I really appreciate your help with all of that. I think that's it. Danielle, can you think of anything else? Awesome. Okay, thank you guys. Bye-bye.